CAR T-cell therapy has really begun to become a standard of care in hematological cancers that express particularly CD19 and has made a huge impact on survival for patients with resistant, heavily pretreated cancers in that setting. And what we're trying to do is use a CAR T-cell approach to treat a very different type of malignancy, head and neck squamous cell carcinoma, which is a solid tumour. Solid tumours pose a raft of different challenges to CAR T-cell therapy, and some of the key ones that we're trying to address with our protocol are first and foremost the fact that we're seeing in the CD19 targeting CAR trials that resistance is occurring and that the tumours are losing expression of the target antigen, which is CD19. And our approach uses a receptor that's based on a ligand that's able to interact with more than one receptor, therefore offering an approach that is hopefully going to overcome a degree of resistance in the tumour. We're also trying to treat a patient population that carry a very heavy burden of comorbidity. The patients who suffer from head and neck cancer, traditionally old, frail, have other comorbidities affecting their health, and using some of the approaches that have been instrumental in the success of CD19 targeting CAR approaches in those patients, like aggressive lymphodepleting chemotherapy that opens up the risk of toxicity with cytokine release syndrome, neurotoxicity, etc. It's going to be harder to undertake in this kind of patient population. So with the T4 trial, our T-cells are administered intratumorally rather than intravenously to try and target as much of the activity where it's needed in the local regional disease, and reduce the risk of the T-cells getting into the circulation and causing toxicity on target but off tumour. And we're not lymphodepleting the patients to try and reduce, again, to de-risk the toxicity associated with this therapy. Now, another really fundamental difference about our approach compared to the other clinical trials that are ongoing with CAR T-cells in different settings is that we don't leukapheresis the patients. We are able, using a chimeric cytokine receptor called the 4-alpha-beta that we co-express with our CAR, to manufacture cell products with 100% success rate to date from as little as 40 millilitres of whole blood, but normally about 120 millilitres of whole blood from our patients. And we do this over a 14-day period.